Here's a comprehensive overview of dementia and Alzheimer's disease, along with 40 Nclex style questions that include answers and rationales. Dementia definition: a general term for a decline in cognitive function severe enough to interfere with daily life. It includes various types, the most common being Alzheimer's disease. Types: Alzheimer's disease, characterized by progressive memory loss and cognitive decline. Vascular dementia results from reduced blood flow to the brain, often due to strokes. Lewy body dementia, associated with abnormal protein deposits leading to cognitive decline and motor symptoms. Frontotemporal dementia involves personality and behavioral changes as well as language difficulties. Alzheimer's disease symptoms: memory loss, confusion, difficulty with language, changes in mood and impaired reasoning. Stages: early stage, mild memory issues and difficulty planning. Middle stage, increased confusion and trouble recognizing loved ones. Late stage, severe cognitive decline and loss of ability to communicate. Nursing considerations assessment. Use cognitive assessment tools like the Mini Mental State Examination, or MMSE, and Montreal Cognitive Assessment, or MoCA. Nursing diagnoses: impaired memory, risk for injury, disturbed thought processes, caregiver role strain. Interventions: focus on safety, effective communication, establishing routines, patient engagement, nutrition monitoring, and caregiver education. Medications: cholinesterase inhibitors such as donepezil and rivastigmine and memantine for symptom management. Section Nclex questions 1 through 10. A patient with Alzheimer's disease is experiencing memory loss. What is the most appropriate nursing diagnosis? A. Impaired memory. B. Risk for injury. C. Disturbed sleep pattern. D. Ineffective coping. Answer: A. Impaired memory. The primary issue for patients with Alzheimer's is memory impairment, which affects their daily functioning. Which medication is commonly prescribed for a patient with moderate Alzheimer's disease? A. Donepezil, Aricept. B. Sertraline, Zoloft. C. Metformin, glucophage. D. Levothyroxine, Synthroid. Answer A. Donepezil, Aricept. Donepezil is a cholinesterase inhibitor used to improve cognitive function in Alzheimer's patients. What is the primary goal of nursing care for a patient with Alzheimer's disease? A. Cure the disease. B. Ensure safety and provide support. C. Promote independence at all costs. D. Facilitate family therapy. Answer: B. Ensure safety and provide support. The focus is on maintaining safety and quality of life for the patient. A family member of a patient with dementia expresses frustration. What should the nurse do? A. Encourage the family member to be more patient. B. Provide resources for caregiver support. C. Suggest they take a break from caregiving. D. Tell them it's not that hard. Answer: B. Provide resources for caregiver support. Supporting caregivers is crucial, as they often experience stress and frustration. Which statement by a nursing student indicates a need for further education about Alzheimer's disease? A. Alzheimer's is a type of dementia. B. It only affects memory and not other cognitive functions. C. Symptoms can vary from person to person. D. It is a progressive disease. Answer: B. It only affects memory and not other cognitive functions. Alzheimer's affects various cognitive functions including reasoning, language, and personality. What is a common side effect of memantine, Namenda? A. Nausea. B. Dizziness. C. Diarrhea. D. Weight gain. Answer: B. Dizziness. Dizziness is a known side effect of memantine, necessitating monitoring. A nurse is evaluating a patient with dementia. Which finding would indicate a need for further assessment? A. Difficulty finding words. B. Occasional disorientation. C. Sudden personality changes. D. Forgetting recent events. Answer: C. Sudden personality changes. Sudden changes can indicate an underlying issue such as a mood disorder or delirium. Which intervention is most effective for managing wandering behavior in a patient with dementia? A. Restraining the patient. B. Providing a safe enclosed area. C. Ignoring the behavior. D. Increasing stimulation in the environment. Answer: B. Providing a safe enclosed area. Creating a safe environment can help prevent wandering while allowing some freedom. When communicating with a patient with Alzheimer's disease, the nurse should A. Use complex sentences. B. Speak quickly to maintain engagement. C. Use simple, clear language. D. Avoid eye contact. Answer: C. Use simple, clear language. Clear communication is essential for understanding and reducing frustration. A nurse is caring for a patient with dementia who is exhibiting aggressive behavior. What is the best initial intervention? A. Restrain the patient. B. Leave the patient alone. C. Speak in a calm and reassuring manner. D. Confront the patient about their behavior. Answer: C. Speak in a calm and reassuring manner. A calm approach can help de-escalate aggressive behavior. Section Nclex, questions 11 through 20. Which of the following is a common behavior in patients with Alzheimer's disease? A. Increased socialization. B. Repetitive questioning. C. Enhanced problem-solving skills. D. Improved memory recall. Answer: B. Repetitive questioning. Patients often repeat questions due to memory loss. A nurse is educating a family about Alzheimer's disease. Which statement indicates a need for further teaching? A. Alzheimer's is a progressive disease. B. It only affects older adults. C. Symptoms can vary from person to person. D. Cognitive decline may occur gradually. Answer: B. It only affects older adults. While it is more common in older adults, Alzheimer's can affect younger individuals as well. What is the best approach when a patient with dementia becomes agitated? A. Confront the patient about their feelings. B. Change the subject to distract them. C. Validate the patient's feelings and provide comfort. D. Leave the room until they calm down. Answer: C. Validate the patient's feelings and provide comfort. Validating feelings can help reduce agitation and promote trust. Which dietary intervention may be helpful for a patient in the late stages of Alzheimer's disease? A. High-fiber diet. B. Soft foods that are easy to swallow. C. Low-sodium diet. D. High-protein diet. Answer: B. Soft foods that are easy to swallow. Patients in late stages often have difficulty swallowing, so soft foods are appropriate. A nurse is discussing advanced care planning with a patient diagnosed with dementia. What is the most appropriate initial question? A. Have you considered hospice care? B. What are your wishes for future medical care? C. Do you want to continue aggressive treatments? D. How much do you understand about your illness? Answer: B. What are your wishes for future medical care? This question prioritizes the patient's values and preferences. Which environmental modification can help reduce confusion for a patient with Alzheimer's disease? A. Dim lighting in the room. B. Cluttered living space. C. Clearly labeled rooms and items. D. Frequent changes in decor. Answer: C. Clearly labeled rooms and items. Clear labels can help orient patients and reduce confusion. A nurse is teaching a caregiver about the care of a patient with dementia. What should be included? A. Ignore repetitive questions. B. Establish a consistent routine. C. Limit social interactions. D. Avoid discussing the illness. Answer: B. Establish a consistent routine. Routines can help provide structure and reduce anxiety for patients. What is the primary focus of nursing care for a patient with Alzheimer's disease? A. Treat the underlying disease. B. Promote safety and quality of life. C. Ensure the patient adheres to medication. D. Limit family involvement. Answer: B. Promote safety and quality of life. Safety and maintaining quality of life are paramount in care strategies. The nurse is assessing a patient with dementia. Which finding requires immediate attention? A. Occasional confusion. B. Loss of appetite. C. Sudden change in behavior. D. Mild forgetfulness. Answer: C. Sudden change in behavior. Sudden behavioral changes can indicate a medical issue or significant decline. Which statement by a caregiver indicates a need for further education regarding Alzheimer's disease? A. Alzheimer's is a progressive disease. B. My loved one may have difficulty recognizing me. C. Once diagnosed, there's no hope for improvement. D. I should create a structured routine. Answer: C. Once diagnosed, there's no hope for improvement. While Alzheimer's is progressive, supportive care can improve quality of life. Section Nclex questions 21 through 30. A nurse is monitoring a patient on donepezil, Aricept. Which side effects should the nurse be particularly aware of? A. Weight loss. B. Bradycardia. C. Hypertension. D. Hyperglycemia. Answer: B. Bradycardia. Donepezil can cause bradycardia, which requires monitoring. What should the nurse prioritize when caring for a patient with dementia who is at risk for falls? A. Providing restraints. B. Ensuring a clutter-free environment. C. Encouraging independence and mobility. D. Leaving the patient alone. Answer: B. Ensuring a clutter-free environment. A safe environment reduces the risk of falls. Which behavior by a nurse would best demonstrate empathy toward a patient with dementia? A. Making quick decisions for the patient. B. Listening attentively and validating feelings. C. Expressing frustration when the patient is confused. D. Avoiding discussions about the patient's condition. Answer B. Listening attentively and validating feelings. Empathy is shown through active listening and support. In providing care to a patient with dementia, the nurse understands that which of the following is true. A. Patients will always be aware of their surroundings. B. Behavior changes can indicate unmet needs. C. Cognitive decline only affects memory. D. Patients do not require emotional support. Answer B. Behavior changes can indicate unmet needs. Changes in behavior often signal discomfort or unmet needs. Which statement about Alzheimer's disease is accurate? A. It is a normal part of aging. B. It only affects memory. C. There is currently no cure. D. Patients can fully recover. Answer C. There is currently no cure. Alzheimer's is a chronic condition with no cure, though symptoms can be managed. A nurse is assessing a patient with dementia who is experiencing hallucinations. What is the appropriate nursing intervention? A. Argue with the patient to correct their perception. B. Provide reassurance and a calm environment. C. Ignore the hallucinations. D. Restrain the patient to prevent injury. Answer B. Provide reassurance and a calm environment. Providing reassurance helps alleviate anxiety associated with hallucinations. During a routine assessment, the nurse notes that a patient with dementia has lost weight. What should be the nurse's priority action? A. Document the finding and continue with the assessment. B. Investigate potential causes for the weight loss. C. Increase the patient's caloric intake immediately. D. Notify the physician of the weight loss. Answer B. Investigate potential causes for the weight loss. Understanding the cause of weight loss is essential for addressing nutritional needs. A nurse is educating a patient's family about the progression of Alzheimer's disease. Which statement indicates the need for further education? A. Alzheimer's affects everyone differently. B. The disease will eventually lead to complete dependence. C. It is a reversible condition. D. Cognitive decline may occur gradually. Answer C. It is a reversible condition. Alzheimer's is not reversible, it is a progressive and chronic condition. Which intervention can help a patient with dementia maintain some independence? A. Providing step-by-step instructions for tasks. B. Doing all activities for the patient. C. Restricting access to personal items. D. Encouraging the use of complex tools. Answer A. Providing step-by-step instructions for tasks. Step-by-step instructions can promote independence while ensuring safety. A nurse is helping a family develop a care plan for a loved one with Alzheimer's disease. Which aspect is most important to include? A. Financial planning for long-term care. B. Strategies for managing daily activities. C. Arranging for extensive medical interventions. D. Establishing a strict daily schedule. Answer B. Strategies for managing daily activities. Daily activities are critical for maintaining a sense of routine and purpose. Section Nclex, questions 31 through 40 and conclusion. Which of the following is a common misconception about Alzheimer's disease? A. It only affects older adults. B. It is characterized by memory loss. C. It is a normal part of aging. D. There are various types of dementia. Answer A. It only affects older adults. Alzheimer's can occur in younger individuals, though it is more prevalent in older adults. A nurse is caring for a patient with severe dementia who is refusing to eat. What is the most appropriate nursing action? A. Force the patient to eat. B. Offer small, frequent snacks. C. Document the refusal and move on. D. Notify the physician immediately. Answer B. Offer small, frequent snacks. Small, frequent snacks can be less intimidating and encourage nutrition. A patient in the late stages of Alzheimer's disease is no longer able to communicate verbally. What is the best approach for the nurse? A. Assume the patient cannot understand anything. B. Speak to the patient as if they can understand. C. Use medical jargon to explain procedures. D. Avoid all verbal communication. Answer B. Speak to the patient as if they can understand. Patients may still comprehend emotions and tones even if they cannot respond verbally. A nurse is evaluating the effectiveness of a care plan for a patient with Alzheimer's disease. Which outcome indicates success? A. The patient is able to recall recent events accurately. B. The patient participates in daily activities with minimal assistance. C. The patient no longer shows any signs of confusion. D. The patient has no further need for caregiver support. Answer B. The patient participates in daily activities with minimal assistance. Maintaining participation in activities is a key goal in dementia care. Which statement by a caregiver indicates a need for further education regarding Alzheimer's disease? A. I understand that my loved one will need more support as time goes on. B. I can't believe they forgot my name, this is just a phase. C. It's helpful to have a routine for my loved one. D. I should pay attention to changes in behavior. Answer B. I can't believe they forgot my name, this is just a phase. Forgetting names is a symptom of Alzheimer's and not just a phase. Which of the following should the nurse include when educating a family about safety measures for a patient with dementia? A. Provide the patient with keys to the house. B. Remove sharp objects and hazardous materials. C. Allow the patient to cook independently. D. Encourage the patient to take walks alone. Answer B. Remove sharp objects and hazardous materials. Safety is a priority, and removing hazards helps prevent accidents. What is the best way for the nurse to monitor a patient's cognitive function over time? A. Conduct a single assessment at the time of admission. B. Use standardized cognitive assessment tools regularly. C. Ask the patient's family about changes in behavior. D. Rely solely on the patient's self-reporting. Answer B. Use standardized cognitive assessment tools regularly. Regular assessments provide objective data to track cognitive changes. A nurse is caring for a patient with dementia who is exhibiting signs of depression. What is the most appropriate intervention? A. Encourage the patient to engage in activities. B. Dismiss the patient's feelings as normal. C. Recommend medication immediately. D. Isolate the patient from others. Answer A. Encourage the patient to engage in activities. Engagement in activities can help improve mood and reduce depressive symptoms. The nurse is preparing to administer medications to a patient with Alzheimer's disease. Which of the following is the priority nursing action? A. Administer the medication quickly to avoid confusion. B. Explain each medication in detail to the patient. C. Ensure the patient is in a calm and quiet environment. D. Provide the patient with a written list of medications. Answer C. Ensure the patient is in a calm and quiet environment. A calm environment helps minimize confusion and anxiety during medication administration. What should a nurse keep in mind when planning care for a patient with dementia? A. The patient has no understanding of their condition. B. Patients may have fluctuating levels of awareness. C. Patients will always follow the care plan. D. The family should be excluded from care discussions. Answer B. Patients may have fluctuating levels of awareness. Cognitive function in dementia can vary, affecting the patient's ability to engage with the care plan. Conclusion: understanding dementia and Alzheimer's disease is essential for nursing practice. These Nclex style questions, along with their answers and rationales, will help reinforce your knowledge and prepare you for the exam. Focus on the nursing interventions, patient safety, and effective communication as key components of care.